I'm going to talk today about being pregnant and having breast implants. This question comes up quite a lot, and it comes up in two groups of patients. One group of patients who are thinking of having breast implants and are wondering what the consequences will be if they were then to go on and get pregnant. And the other group of patients are the patients who've got implants in already who discover that they are pregnant. Now, the first thing that I like to say is that there's absolutely no problem with this, so it's absolutely nothing to worry about. But if you are considering having breast implants, it is something that you should think about, because mainly having a pregnancy and having children can affect the size and the shape of your breasts. So if you are thinking of having breast implants but also haven't finished your family and considering maybe having children in the future, the advice would always be that you should finish your family first, because if you have implants and then you go on to have children, it can have an unpredictable effect on the size and the shape of your breasts. Your shape can get bigger when the milk comes in. They then can get smaller. Sometimes they go smaller than they were before. Sometimes they stay big. Sometimes they droop. It's unpredictable what can happen to the shape of your breasts if you have children. For that reason, if you're considering children, then it's best to avoid breast reshaping surgery until you have finished your family. Now, you might say it's going to be many years before I finish my family and I really want to have implants now, in which case that's absolutely fine. You can have implants now. There's absolutely no problem with it. And this is one of the concerns that I think people have if they have implants in and then they fall pregnant. They think there's going to be a problem, and there's absolutely no problem with it. There's no problem with breastfeeding, whether the implants go in front or behind the muscle. They always go behind the breast tissue, and so particularly the way that I tend to do breast augmentation, which is using what's called an inframammary incision, which is in the fold where the bra sits. So none of the breast tissue is damaged, and so the ducts should all still be intact, assuming you can breastfeed already. So some people can't breastfeed. So assuming you can breastfeed already, having implants should not affect your ability to be able to breastfeed. You'll be absolutely fine breastfeeding afterwards, whether or not you've got implants in. Sometimes when people use what's called an infraareolar incision, not so popular in this country. I tend to use it quite a lot in America, but there is a potential for damaging some of the ducts using that incision. But if you use an inframammary incision, it's much less likely to have any problems with the milk ducts, and so your ability to breastfeed will be just the same. Now, there is some evidence to say that some silicone does get expressed in the breast milk with silicone implants, but at the same time there is silicone on the teats that we use to feed our babies, and so there's absolutely no problem with it. It's not harmful in any way. There's absolutely no problem with having breast implants in and then becoming pregnant. The only problem is that if you do have breast implants in and then go on to become pregnant, as I said, it might affect the shape and size of your breast. But if you've already got the implants in, there's not a lot you can do about it. So I wouldn't particularly worry about it, because it may well be that your breasts will recoil and resume their original shape afterwards. But if they don't, there are things we can do if needed to adjust the size and the shape of the breast. But I would say just enjoy your pregnancy. Don't worry about it. There's absolutely no harm in it, and there's absolutely no problem if you are to fall pregnant with breast implants in. I hope that's been helpful. As ever, if you've got any questions, please feel free to get in touch. We'd love to hear from you, and I can answer your questions directly.